Only 3% of medical students get this really high-yield USMLE question correct. Let's go through this question. Which of the following virulence factors is most likely responsible for this patient's skin findings? And you can see the skin findings here, and they've given us a bunch of toxins here. So let's read the question now. A 62-year-old woman with metastatic breast cancer presents with a 2-day history of fever, chills, and new, initially painless red macules on the gluteal region that rapidly progressed to painful ulcers overnight. She completed her 4th course of palliative chemotherapy 2 weeks ago. Her temperature is 38.2 degrees Celsius. Laboratory studies show a leukocyte count of 2000 with a 20% segmented neutrophils. A photograph of one of the skin lesions is shown. So basically what's happening is this elderly female is having chemotherapy, which has probably caused some immunosuppression, and you can see the granulocytosis. She only has 20% of segmented neutrophils, which is about 400 neutrophils, which is agranulocytosis. And in the context of that, she's developed this acute, rapidly progressive red macules on the gluteal region that have now progressed to painful ulcers. And now there's fever. And you can see these findings here. And they're asking us what toxin causes this. So the first one is edema toxin. So edema toxin is likely not the answer because it's seen with Bacillus anthrax. And this is not the typical presentation of Bacillus anthrax. There you need to get some envelope or something. It's not typically present in immunosuppressed patients. So we're going to rule that out. Heat stable toxin is seen with enterotoxigenic E. coli, which causes traveler's diarrhea. So that likely is not the answer because we don't see any diarrhea and this patient doesn't have a travel history. Toxic shock syndrome, toxin 1. This is caused by Staph aureus. This only presents when there is unhygienic tampon use, where tampons are left for more than 24 hours, which can cause systemic sepsis, and it presents in a very severe condition, which we don't really see here. So I'm going to rule that out. So exotoxin A is seen with Pseudomonas aeruginosa, which causes ecthyma gangrenosom. This mainly happens in immunosuppressed patients, and it has a typical presentation where it goes from macules to ulcers, which you can see here. So my guess is it's exotoxin A, which is the answer. So let's see if it's the correct answer. So it is correct. What about the other options, alpha toxin and the endotoxin? So let's go through those as well. Alpha toxin is produced by Clostridium frugens, which causes gas gangrene and myonecrosis. There you should see crepitus and soft tissue gas, which we are not really seeing here, so it's not really the answer. Endotoxin is produced by gram-negative bacteria when they cause systemic sepsis. We are not really seeing hypotension here. Plus also endotoxin, generally you'll see a local necrotic skin finding, but you don't really just see one local necrotic skin finding. You see a generalized rash that is spreading. One essential high-yield USMLE point you should know here is the key factor here is exotoxin A, which inhibits EF2 factor. It uses ADP ribosylation and it inactivates EF2. And by the way, guys, if you want to start your USMLE prep for completely free through my USMLE AI Q Bank, go to the link in my bio.